Hello, Janet. How are you doing? So nice to see you and Susie again so soon for a checkup.
Hi, Dr. Brown. I'm doing pretty good. I've just been very exhausted. Motherhood can be so tiring. Susie is such a handful.
That is as to be expected. But how is she otherwise?
Well, Doctor, I'm not sure. She's eating well and going through a lot of diapers, but I'm still a little bit concerned.
Why is that?
She's not making much eye contact with me. Is that normal for this age?
Yes, that's perfectly normal. She's 2 weeks old. It's normal around 4 weeks for her to begin to make eye contact, and shortly after the first month, eye contact will become more regular. You should not be concerned until then. However, anxiety is a perfectly normal response for you to feel because she's not making much social interaction right now, and eye contact is a major facilitator of social interaction. You'll feel much better in about a month after she's able to really interact with you.
That is such a relief, Doctor. Is there anything I can do to help her along?
There are some things that you can do to facilitate her perceptual development. Increase face time with her. Use every opportunity while you can. Look into her face while you're feeding, changing, etc. You'll notice that when you're talking to her, eventually she'll begin to fixate on your eyes. By 5 or 6 months, she'll begin to smile back at you when you do so. Allow her time to just gaze about and look at your face whenever you're changing and feeding her, etc. Remember, however, that babies are classified as auditory, visual, or tactile learners, just like adults are, and so you may need to use a combination of these techniques to get her attention and keep it.
I see. When should I be concerned if she's still not catching my gaze?
Well, some infants are predisposed to gaze aversion, but this usually subsides around about 3 months. If she's still avoiding your gaze at this time, then we can run some tests. However, make sure that even though she's avoiding your gaze, that you're not avoiding hers because you're becoming frustrated. Eventually, she will seek to initiate eye contact. Mothers may exhibit gaze aversion as well.
I see. I don't think that will be an issue. I love her baby blue eyes.
Trust me, she loves your face as well. Discrimination between faces begins within hours after birth. Preference for the face of an infant's mother or primary caregiver also begins in that very short amount of time. Very little experience with their mother's face is needed for newborns to rapidly process and store the information in stable long-term memory. As early as 7 months, she'll be able to process facial configurations rather than just the individual features of your face.
Okay, good to know. Is the same thing happening when she's looking at my husband?
Well, not necessarily. Infants prefer attractive faces to non-attractive faces, and male faces to female faces. This may be due in part to prototype formation, for which attractive and female faces are more closely matched to a prototype. Categorization and stereotypes also form early in infancy, which helps infants to recognize familiar sights but exclude unfamiliar ones, such as male faces that are not prototypical. The more exposure that she has to her father's face, though, the more easily she'll be able to process it.
Wow, I never knew that. If male faces are not prototypical, what about faces of other races?
Well, there is this thing called the other race effect, which occurs due to perceptual narrowing that happens about 9 to 12 months of age, which causes infants to struggle in distinguishing faces of another race that they don't have much exposure to.
Is there anything I can do to prevent that from happening?
Well, we're not sure if it can be prevented, but there are some steps that you can take to minimize it. Expose her to other races early in life, and continue to do so as she ages. Pictures and videos are acceptable forms of doing so. It would also be helpful to expose her regularly to males in order to reduce the female bias, and have men like your husband play more visual games with her to get and keep her attention. In general, give her more experience with faces for more fluent processing.
Wow, that sounds like a lot to ask, Doctor. Is there any negative consequences if I don't?
Not particularly. Ease of processing is linked with effective processes, though, and she should be more comfortable with both genders and various races if you're able to do so. She will develop normally, though, either way. These are just recommendations for promoting optimal facial perceptual development. More research is needed to gain an understanding of how infants perceive non-prototypical stimuli.
Thanks, Dr. Brown. I appreciate it.
Not a problem. Now let's see how that little heart of hers is beating.